Welcome, everybody. Welcome to another episode of PEM Rules, the Pediatric Emergency Medicine podcast. I'm your host, Yaron Ivan, as usual. And today, some more important rules in the clinical care tips category. Rule number 107. Mistakes are learning opportunities. Don't make the same mistake twice. This is, I think, a very good rule for us emergency physicians or physicians to keep in mind, simply so we don't beat ourselves for mistakes we make. I certainly agree that mistakes in medicine can have some serious ramifications to the patient, especially in emergency medicine, especially in pediatric emergency medicine. Nonetheless, we do not make mistakes on purpose, and if we view them as learning opportunities, try to avoid them in the future, everybody is just better off. I myself have made many mistakes in my history, physical exam, speaking to parents, speaking to patients, etc. I try not to beat myself over it and think about those mistakes as learning opportunities. In fact, in residency, when I just became a doctor, I used to have a mistake journal. It used to be on paper, now it's on my iPhone. Every time I do something that I think I should have done differently, I write it down and I make sure I do not make the same mistake twice. Common mistakes that I've seen pediatric emergency medicine physicians do, and again, myself including, is omitting something from the documentation that later on becomes important. Omitting part of the physical exam, like testicular exam on a teenager boy with abdominal pain. Forgetting to order ovarian ultrasound on a female with right lower quadrant pain and working her up for appendicitis only, etc. This is, in my opinion, where medical education can be very helpful. So, as I said, mistakes are learning opportunities and they are therefore, by default, teaching opportunities. So I teach my residents and my medical students and anyone else who's interested what my mistakes were and try to prevent those people from making the mistakes I have made as a trainee, as an attending, etc. So remember, don't make the same mistake twice. Mistakes are learning opportunities. Note them, review them, teach them to others so others can avoid them and try not to do them again. Rule number 108. Never worry about a smiling baby and avoid the workup. This is something that I personally feel very strongly about. I think we all know that the patient's physical exam, specifically the general physical exam, in other words, the child's demeanor and what they kind of look like, is probably one of the most important components of the physical exam. So when I enter a room and there's a child sitting up in bed, maybe having a snack and smiling, I think it's very important to keep in mind that likely this is not serious abdominal pain, surgical abdomen. Likely not bacterial infection causing the fever. So a smiling child to me is probably the most important component of the physical exam. And most of the time, I take the time to sit down with the parent and just provide reassurance. I find it hard to believe that a child with meningitis would be sitting up in bed and smiling. I find it hard to believe that a newborn, 6 months old for example, who's been having a lot of spit-ups or vomiting per mom and is smiling has intussusception or maybe malrotation with valvulus, etc. So going back to the very basic of physical exam, what does the patient look like? I never worry about a smiling baby, and I try to keep in mind that maybe I should avoid the workup and just provide reassurance to the parents. So remember Rule 108, never worry about a smiling baby and avoid the workup. Certainly, as we said before, worried parents don't go home. So if the parents are worried about that smiling baby and the cost of unworrying them is a simple blood test or a chest x-ray, by all means, discuss the situation with them, maybe compromise your rules and do the workup that they require in order to feel reassured and maybe not come back to the emergency department tomorrow with the same concern. Rule number 109. Blood work never saved anyone. If you have access, stop and don't sacrifice the IV for labs. This, I think, goes back to my primary role as a pediatric emergency physician. Again, going back to some of the episodes in the past, I believe that as a pediatric emergency physician, my most important and first role is to provide acute care. Maybe it's CPR with chest compressions, maybe it's just piozophrin, Maybe it's IV so I can give fluids. But blood work, especially something like a CBC and CMP, never really saved anyone and doesn't really provide any relief to the patient. So when I get an IV, I try to remember maybe give fluids first, give antibiotic first if I'm worried about a serious infections, etc. But keep in mind that blood work never saved anyone. A classic example is a child with sickle cell disease and fever. Thinking about the very basics of pediatric emergency medicine, the concern with sickle cell disease and fever is that there may be bacteremia, may be acute chest syndrome. So yes, I get my lab work, but I remember that the IV is there is to give fluids because that's part of the treatment for what is possibly shock. That is part of the treatment for what is possibly acute chest, and that is the first order of treatment for a patient with sickle cell disease and fever. Yes, I do need that CBC to make sure there's no hemolytic crisis. Yes, I do need this blood culture, but if the assumption is sepsis, maybe providing the antibiotics is more important than everything else, as well as the fluids. I have worked with many students who prioritize the testing, namely CBC, first before the intervention. So keep in mind, blood work never saved anyone. If you have access, stop and don't sacrifice the IV for labs. Rule number 110. Know the red flags. This is arguably one of the more important rules I've ever discussed. And yes, I know you probably are saying he has said that before, that's probably true, but knowing the red flags is one of the most important things to know for a pediatric emergency physician. And again, this goes back to rule number 1. It's not the patient's job to prove that they're sick, it's your job to prove that they're not. Rule number 2, you're not in the business of winning, you just don't want to lose. I do all those things by knowing the red flags. A great example, again, abdominal pain. There are many causes of abdominal pain in children. As a pediatric emergency physician, I must know all the surgical abdomens or the serious causes of abdominal pain. Of course, appendicitis always comes to mind. There is no way in the world I can tell every patient with abdominal pain what he or she has, but I must be able to tell them that abdominal pain is not appendicitis, not a surgical abdomen, and not serious. The way to do that is to know the red flags. So abdominal pain is a good example because we all know that if it's right lower quadrant, that's a red flag. We all know that if there's bilious or bloody emesis, that is a red flag. We all know that if the patient has peritoneal signs, meaning he or she cannot jump, that is a red flag. We all know about obturator sign and psoas sign, etc. So by knowing all the red flags, we can hopefully rule out appendicitis or surgical abdomen. So as a pediatric emergency physician, it's very important to know the red flags. It's impossible to review and know and memorize all the causes of abdominal pain. But as a pediatric emergency medicine physician, I must know all the surgical causes of abdominal pain and know how to find them. Another good example that I discussed in a previous episode about pediatric rashes is not missing the bad, serious causes of rashes. Again, Stevens-Johnson syndrome always comes to mind. The way I do that is knowing the red flags of pediatric rashes. Anything that doesn't blench makes me a little worried. Anything that is vesicular makes me a little worried. Everything that involves the mucous membranes, positive Nikolsky sign, etc. There is no way that any physician can possibly memorize and know all the pediatric rashes, unless you are a pediatric dermatologist, of course. But as a pediatric emergency physician, I must recognize all the serious causes of rashes, again, Stevens-Johnson syndrome, maybe Henlach-Schlein purpura, etc. And I do that by recognizing the red flags on history, on physical exam of pediatric rashes. So remember, when you're in the ER and you're seeing a patient with chief complaint X, make sure you know all the red flags for chief complaint X by history, physical exam. And if the patient has none of those, give them a good education and good follow-up with the primary care and send them on their way. So remember rule number 110, know the red flags. And that is it for today, guys. Thank you very much for listening. Please check out my website at PEMRules.com. Submit any feedbacks. I love hearing from you guys. Also, please don't forget, you can check out EP Monthly at epmonthly.com. That is an emergency medicine journal that now has PEM Rules as one of the columns. Thank you very much for listening. I hope you have a great day. This is one of Lenny Kravitz's best songs, Are You Gonna Go My Way? Great guitar riff.